Good afternoon and welcome to the 178th of the COVID calls. This is a daily discussion of the COVID-19 pandemic with a diverse collection of disaster experts. My name is Scott Gabriel Knowles. I'm a historian of disasters at Drexel University in Philadelphia. Today we have a discussion of the COVID-19 crisis in France with Olivier Bourras and Patrick Castel, authors of the new book, COVID-19, An Organizational Crisis. Just a reminder, you can catch COVID Calls live every weekday at 5 p.m. Eastern Time on YouTube. Just go to the COVID Calls YouTube channel to watch. You can also watch COVID Calls on Facebook Live and on Periscope. You can hear COVID Calls anytime, recorded as podcasts on Spotify, iTunes, Podbean, or anywhere you get podcasts. You can also keep up with COVID Calls via Twitter using the handle @USOFDisaster or @COVID Calls. Please do help spread the word and send suggestions for future guests and future topics. Please feel free to suggest yourself as a future guest. As of today, December 1st, 2020, there are 1,475,851 deaths from COVID-19 globally, according to the Johns Hopkins University Coronavirus Resource Center. There are 13,653,957 cases of COVID-19 reported in the United States, and there are now a total of 269,667 deaths reported in the United States from COVID-19. That's up from 267,635 reported yesterday, over 2,000 deaths day to day. As a way to bring some humanity to the numbers, I've been reading a life story or a story of advocacy for those impacted by the pandemic in some way, and I'd like to continue that now. The headline is, "A Paris Neighborhood Honors 92-year-old Holocaust Survivor Who Died After COVID-19 Bout." This appeared in Public Radio International's program The World, September 2nd, by Rebecca Rossman. Le Château Landon is a quiet, nondescript brasserie in the 10th arrondissement of Paris, steps away from the Gare de l'Est railway terminal. Not much about the black and red interior stands out, but the cafe has kept a steady clientele of regulars for decades, many of whom are older people. In April, it lost one of its favorite regulars, a 92-year-old man named Eugene Deutsch, who had survived the Holocaust, then a bout with COVID-19. Deutsch was a neighborhood figure known for making the daily rounds at the local cafes and bakeries. He would have his morning coffee at Le Château Landon, followed by an afternoon Côte de Rhône wine at the neighboring Le Cristal. In between, he would buy himself a fresh baguette, always bien cuite or well done. But when France went into lockdown in mid-March, this routine was upended. Deutsch's health quickly deteriorated. Philippe, the cafe's owner, says that once the lockdown took effect, Deutsch lost his taste for life. It's something he's seen happen to many older people in the neighborhood. Older people aren't necessarily dying of COVID-19, but in a way they're dying because of it, he said. Deutsch was hospitalized shortly after the lockdown took effect. Neighbors say that he was diagnosed with COVID-19 but recovered and went home. He died a few weeks later from an unrelated health issue. He had lived in the same building for more than 6 decades. James Smurthwaite was one of Deutsch's neighbors. Imagine spending 62 years somewhere, and when you leave, it's met with complete silence. Imagine spending those years, when you leave, it's met with complete silence. Let me take that again. Imagine spending 62 years somewhere, and when you leave, it's met with complete silence, Smurthwaite says. While they rarely exchanged more than simple pleasantries, Smurthwaite says he was deeply touched by Deutsch and wanted to do something to honor his memory. In late April, he attached an obituary to a tree in front of their building. Deutsch was generally reserved and didn't talk much about his personal life, but here's what Smurthwaite was able to share. Eugene Deutsch was born in Hungary in 1928. When he was a boy, he was sent to the Buchenwald concentration camp in Germany, something he never spoke about after the war. In the 1950s, he settled in Paris, where he worked as a security guard at a department store. Deutsch never married or had children, but he enjoyed being around others. Smurthwaite says that above all, Deutsch loved being outside and used to walk for miles every day. Smurthwaite hopes those reading the dedication he posted will spare a thought for the many older people now stuck inside and who, like Deutsch, may never see a world post-COVID-19. With COVID-19, this generation will know only their last days in this context, and I think that's devastating, Smurthwaite says. Back at the cafe, the owner, Philippe, who only goes by his first name, grabs a teeny tiny wine glass he keeps on a shelf behind the bar. It's so small they don't actually make this kind of glass anymore, but he kept it for Deutsch. And now this glass is sad, he says. It's a small souvenir of someone who I miss dearly, someone who was a pillar of the neighborhood. Okay, I'm really pleased to introduce my guest today. Let's turn to our conversation. Olivier Bourras is a CNRS research professor at Sciences Po in Paris. He is the director of the Center for the Sociology of Organizations, the CSO, a leading research center in sociology in France. His work focuses on risk governance and, more recently, emergency preparedness. He's published several papers on simulation exercises in the French nuclear sector and is currently working on volcano alerts in the French Antilles. Patrick Castel is a FNSP research professor also at Sciences Po and the CSO. He is interested in health policies in general and the organization of research in cancer treatments. His research sits at the crossroads of the sociologies of organizations, decision, and professions. Olivier and Patrick, thank you so much for staying up late and joining me on COVID Calls today.
Thank you.
Thank you.
I like to start the way I usually do, which is to find out where you're calling from. And if you're both in Paris, maybe you will even tell us a little bit about what part of Paris you're in, and tell us where you're calling from and what the pandemic is looking like there today. Olivier, may I start with you, please?
Yes. So we're both living in the suburbs of Paris, close suburbs of Paris. So I'm living in Ivry-sur-Seine, which is in the southeast of Paris, and Patrick is living in north of Paris, Pantin, which is north of Paris. So yes, and we've been locked down now since October 28th. So this is the second lockdown after the one we had from March to May. This time it's a bit lighter. It's a bit easier than the first lockdown. Schools are open. As of last Saturday, actually, also the stores, non-essential stores, have reopened, as have churches also. But there's a current debate about the maximum number of people that can go to church. Ski resorts have reopened, but not ski lifts, so that should be fun.
Huh.
But for the rest, bars, restaurants, museums are still closed, and we still need authorizations to go outside. But we are allowed now to go out for 3 hours a day, up to 20 kilometers away from our houses. So that's the way we've been living for the moment. And many people still work from home. I think that's a bit similar to the spring, but there are still much more people and more cars in the streets. Spring was very quiet, I think, as it was in many other places that were locked down. Now it's much more noisier. People are more stressed also, I find, and it's a different atmosphere than it was in the springtime. And we still have police controls everywhere, and masks are still compulsory. Patrick, you want to add something?
No, it's okay. There's a big difference, and we come back later, is opening of the schools. Schools remain open, and it changed a lot about how workers can work at home, and for stress of children also. It's easy, a bit easier this time.
So the schools are open now, but they were closed in your earlier lockdown phase.
Yes.
Mm-hmm.
Which meant people had to work from home at the same time school their kids from home, which was quite challenging for many parents, as I think it must be in the US, in parts of the US where schools are still closed.
Absolutely. Well, here where I am in New Jersey, they've tried every different sort of hybrid method, going back certain days of the week, 1 week on, 1 week off. It feels like these experiments are happening all over the world right now. Let me just ask you a little follow-up. What's happening at your university? Have you been able to go in? Are students able to come into campus?
No, university is closed. And Sciences Po is a special university, so actually they had anticipated the second wave. So I switched to distance learning this year for most of the students. But the rest of the French universities initially reopened to students physically present in universities. But then since October 28th, they've been closed, and universities should reopen only early February if everything goes well. So it's all distance learning for the moment, which is quite hard for many students, French students in the universities.
In the United States, there's not a
follow-up. Our offices are also closed, but I've managed to reopen them. So this week, for the first time, we'll be able to go 2 days a week back to our offices to work this. And I think it was very important for the researchers, but it was mostly important for the PhD students, candidates.
Right.
They've been suffering a lot from working from home and being isolated. So they really wanted to be able to go back to the office. So this week we'll be able to go back.
Okay, that's interesting. And I was going to ask you about this because in the United States, we don't have centralized education policies. So state by state, even university by university, they've been coming up with their own policies, and with wild variability of results. Is that different in France? Are the policies around what the universities can do have been more centralized, or are they actually allowed to make their own decisions?
I mean, the lockdown has been, the closure has been, it's a centralized decision. The way that universities organize themselves is left to each university. Sciences Po is a different type of university. So where we are, it's a mix of private and public, so it has a little bit more autonomy. But on the whole, yes, it's a centralized system.
Well, I want to congratulate you on somehow getting a book out in the midst of all of this. And we were chatting just a little bit before we started about the real need for these kinds of books to get out early so that people can begin making sense and start, we can't wait for this disaster to be over, for people to start analyzing and make sense of what's happening. The book, again, the title is COVID-19, An Organizational Crisis. I wondered if you would humor me to start out and just give us a little bit of a background to understand the organizations at play in the pandemic in France, maybe a little bit of a backgrounder on the way your emergency management and your public health systems are organized. And either one of you take it. I know you work together, so I'll let you answer however you wish.
Okay, I'll start. I'll very briefly present the way it's organized, but then what's really important to have in mind from now at this point is that the way we handle the crisis is not at all relying on what had been planned for. So I mean, the emergency management in France has been organized since the early 2000s, following a series of disasters, accidents, scandals, and was basically the design dates from 2012 around a centralized system, around what we call a interministerial crisis cell, cellule interministérielle de crise, which is a command center, which is headed by the prime minister. So not the president, and this is very important. It's a prime minister is officially in charge of crisis management, but this management cell is positioned at the Ministry of Interior. So this is the outfit, and the backbone of the system is what we call in French sécurité civile, which is actually what the equivalent to your civil defense. And so that's the backbone of the French emergency management system. Alongside this, you also have a special secretariat directly linked to the prime minister that is in charge of emergency planning and simulation exercises. And this secretariat is actually always been in conflict with the Ministry of Interior as to who should own or be in charge of crisis management. And in terms of planning, we have plans for all types of crises, of course, in emergency situations. For pandemics, the first plan was elaborated in 2004, following both the SARS epidemic and also a major heat wave we had in France in 2003, which killed 15,000 people, which was not a pandemic, but which sort of pointed to flaws in the way we communicated information from hospitals, funeral homes, and local services to the state. There had been, to put it very briefly, the central government missed the heat wave, the first few days of the heat wave in 2003, and then noticed then something was wrong before a few days. So first plan 2004, the plan was revised over and over, and the latest version is from 2011, and it was modified after the 2009 H1N1 pandemic in France. So that's for emergency management. Public health is organized around the Ministry of Health, and in particular, a special directorate in the ministry in charge of health, public health. But this is a very weak directorate compared to the big directorates in the Ministry of Health in charge of healthcare. And this directorate also relies on a set of agencies, independent agencies in charge of health safety, drugs, education, surveillance, et cetera, et cetera. And there's also a wider set of organizations in charge of public health. So this is the general organization. Now, what's striking, and actually what led us to publish papers in the spring and then the book, was the fact that when we started getting signals early January of something going wrong, we did not rely at all on all these organizations and plans. Instead, we sort of, the French government instead sort of set up an alternative system to manage the crisis. And this is part of the puzzle that led to the book. Now, why did they do this? Why did they create new organizations? So, for instance, early January, the Ministry of Health activates its own crisis center, but does not activate the pandemic plan. So it decides it wants to keep things into its own hands. And does not activate the emergency management system either. So it's only based at the Ministry of Health. And then in February, when things start getting signals start getting a bit stronger, the government creates a task force, and the French word for this is task force, which is intriguing, interministerial task force to coordinate actions of all the ministries. But this task force is based within the Ministry of Health, which is also very surprising. And actually this task force puzzled many actors because they didn't know why this was created, and they spent most of their time actually just figuring out how to work together. Most of their task at the time was counting masks. And we'll come back on this later, but then when early March it became clear that there was a major pandemic going on, then the government created a scientific council to advise the president and the prime minister. And this for us is a big surprise, because instead of relying on the set of agencies, public health agencies that were there, that have been involved in managing the crisis, the president chose to create his own scientific council on the side, with no direct link or relation to the agencies, to provide its own advice. And then finally, when the crisis management center was activated on March 17, the first day of the lockdown, immediately this organization was supplemented by other new organizations that sort of took parts of the job and were in charge of coordination. So we never really applied the plans as they had been set up for managing such a crisis, which is really for us the part of the puzzle.
Let me just follow up with something, and maybe Patrick, I'll bring you in on this to understand a little bit about the bureaucracy. In the United States, the higher ranking positions are political appointees. And then there's a long-standing, what our current outgoing president has called a deep state, which many of us are very happy about, because it's a professional bureaucracy of people who might work in emergency management or in public health over their career or over a long part of their career. But we've seen a strong set of difficulties in the United States that the urge to fire career experts and replace them with the political appointees in our emergency management bureaucracy has shown itself to be really problematic in this disaster. So I wanted to get a sense of that in France. How deep do you go into these agencies when you find career experts versus the issue of political appointment?
It's your...
Yeah, I can also answer on that one.
Worked a lot on agencies
the people there, the heads of these agencies, and they're nominated, they're named by the government, but they're not political appointees in the sense that they have no political background. These are people who are mostly experts. So they're chosen by the government, but they have no political affiliations. So I think that's probably a big difference with the US situation.
I see. Okay, that's a useful point of comparison, I think, and we'll probably come back to that. Well, let's talk a little bit more then about what happened. We'll get to the lockdown in a minute, but coming back to this really provocative insight, that you said that in the Secretariat and then the President's office, all of a sudden they start creating alternative bureaucracies in the midst of the pandemic. Why?
Yes, our book, to make it clear, is ask questions and raise issues, and we provide hypotheses, but we don't provide definitive conclusions. So we draw on the literature, on the analysis of decisions in crisis. For instance, we use a lot some works on the Katrina management, on even the Cuban Missile Crisis from Graham Allison and other historian work, and we draw on this literature, and we also conducted some empirical work, and we conducted mainly 40 interviews, and now we are more 60, but definitely we continue this. This is an ongoing empirical work, but still, so I'm very cautious about hypotheses, but I will formulate some of them. First one, the flu pandemic plan may not have been activated because the experts did not believe the threat was serious enough. And when it became serious in early March in France, then it was too late to activate the pandemic plan. All that was left was what we call the white plan. I don't know if it's the same name in the United States, but white plan are helpful to deprogram the surgeries, to stop the surgeries in order to relieve the intensive care units. And they need it at that time because they were overflowed. And so that surgeries bring new patients to intensive care units. And so we have to stop surgeries. So the white plan was useful for this. And it was also useful to recall professionals who were on holidays at that time in February, and also to mobilize the health reserve. But what is interesting is that the white plan in France is mainly designed to receive patients in emergencies such as terrorist attacks or natural disasters, but not for pandemic. So these white plans do not prepare professionals to receive, for instance, contagious patients, how to organize themselves to receive and to select patients and to detect them. So it was, and they were not planned to welcome them in the middle or long term for a pandemic. So it was quite a mistake. But so that's the first hypothesis. The first one relates to the underestimation of the seriousness of pandemics. But another hypothesis, and it relates to what Olivier told us. It's about our often organizational nature. So activating plans, and it's very interesting in the Cuban Missile Crisis, ties the hands of decision makers. And if you go back to the book of Allison, we see that Kennedy is still struggling with plan, and it tries to figure out, and McNamara and Robert. So we put the hypotheses, and we've got some informal and some interviews that seems to confirm this hypothesis that the flu pandemic assumes the activation of the interministerial missile crisis, as Olivier mentioned, and which makes all sorts of other actors and institutions get on the train of decision making. And this can be seen as factors that limit the scope of the room of maneuver for Emmanuel Macron, who wanted to take a direct control on this pandemic. So it's about hyper-centralization. And furthermore, it would complicate the decision-making process, since it would involve the cooperation between the Ministry of Interior and the Ministry of Health. And both ministries do not cooperate very well in general, and the Ministry of Health wanted to take control in this crisis. So this is one also a political hypothesis for for not activating the flu pandemic and activating the white plan that was not as constraining for decision makers as the pandemic plan. And last but not least, there is a mistrust expressed at the highest level of the state for the management carried out by central administration in crisis situations, and in particular civil security. In particular, following the management of the Irma storm, I don't know if it was very important in France because it was devastating for some areas, and it was deemed calamitous by the president and the prime minister, and so they were very distrustful towards the civil security and all the administration of the management of the crisis. So these are some hypotheses about why these plans were not activated.
It's interesting. I mean, some of those hypotheses, they're all fascinating and they ring very true. I mean, the idea of a ministerial competition is something we might expect in disaster or even in non-disaster times. I'm particularly interested in, maybe you could say a little bit more about Macron's role and the desire of an executive to sort of reframe a disaster as something that cannot be really managed well according to the existing structures. Can you elaborate on that part of it a little bit? Because that's been a feature that we've seen in countries that have done well with this, I think. Maybe South Korea and Singapore, but also in countries that have done very poorly with this, like the United States and Brazil. There seems to be some elaboration of executive power happening right now that's worth comparability, I think.
Yeah, I mean, it's in the case of Macron, I mean, there are several elements. I mean, Patrick mentioned the distrust towards the civil protection after the mismanagement of Irma hurricane in the French Antilles. This sort of led him to distrust. But Macron has always been distrustful of the highest of central administrations, of bureaucracies. I mean, it's interesting, but he also talks about a deep state in France, and he is also he always believes that the French administration is resisting any form of reform. So he has very limited trust in his own administration. Even though he is himself a high civil servant, so this is sort of paradoxical, and so he was really careful. I mean, he was really worried at the beginning of the crisis that if he relied too much on existing bureaucracies and organizations, they would impose their own solutions, they would impose their procedures, but they would also introduce their conflicts, the conflicts between the Ministry of Health and Interior, for instance. He would have to manage that. He didn't want to have all these problems, so he sort of decided to create his own organization, to be more free in his way of managing the crisis, and this has continued until now. Nowadays, the decisions are all taken in a special council for defense and security, and this council for defense and security was not at all designed for crisis management. It designs in case of wars, but this council gives him much more freedom in managing politically the crisis than he would be able to do if he had to rely on his own bureaucracy and administration. So I think
that's fascinating. And has he had to deviate from existing some sort of precedents of policy or even law at this time to take those actions, or the system is built to allow the executive to be more assertive in these, as you said, with a war? There's a lot of latitude for the executive in many countries.
Well, I mean, on March 12th, when Macron for the first time spoke to the French population on the crisis, he called it a war, and he used the war metaphor. And ever since then, he's been using that image. So yes, the French system is very centralized around the president. So I mean, legally, what he's been doing is is acceptable. I mean, there's no issue of illegality or anti-constitutionality. It's possible. It was just not designed to be that way.
Right. Yeah. Well, let's talk about the lockdown then, because maybe that's also a bit of a clue. These extraordinary powers do put pressure on organizations, particularly if there's some, and as you said earlier, it's really interesting, Patrick, also that maybe to follow the plan, you bring too many people along and it slows the process down. And when you can start to see the death toll rising, that's politically unacceptable and unsustainable. So let's talk about the lockdown.
Yeah. We identify different sets of conditions, and I will start and we will follow up. But the first set of conditions relates to what I just mentioned, and we may qualify them as organizational. So the lack of activation of the pandemic plan, the delay in activating the interministerial crisis management mechanism, the appropriation of the crisis by the Ministry of Health at the expense of the Ministry of Interior, the mistrust of the health agency. So it led to the creation of an independent body, the Scientific Council, with a strong medical focus. And I will come back later. And it must be added, and this is fundamental, that we identify what we call the phenomenon of organizational drift, to use a famous concept by Diane Vaughan about analysis of the Challenger accident, because we saw that the French state found itself without sufficient mass capacity at the end of February, and it was a surprise for itself, because they thought that they had this capacity, and we put the emphasis that something has to do with organizational drift. So more and more there was a drift from a priority on pandemic in the 1990s, after the SARS, after the MERS-CoV, and so on, and more there has been a drift toward priority toward terrorist risk at the expense of pandemic, and there was also a change in the principle for mask monitoring. And at the end of February, nobody knows inside the government who was in charge of mask. Was it an health agency? What is hospital? And so that's why we put some emphasis about organizational drift. The other mechanism it draws from the work of François de Dieu, who is another author and who worked on the hurricane in 1999 in France, and he identified a mechanism he called a treacherous risk, reference to Goffman. Sorry, thank you. And it seems that it's a risk that seems to be known and that seems to be controllable, but at the end it appeared as uncontrollable. And in the French case, it's very striking, because all the experts, and we look back to their testimonies at the end of January, they say, don't worry. Infectiologists say, don't worry. We manage the SARS, we manage the MERS-CoV, we manage H1N1, we will manage the COVID. So maybe it will be a challenge, but we'll do it. And so it's a kind of overconfidence, because the fundamental thing is that they didn't notice, or they didn't take into account enough the things that they should not rely only on symptomatic patients. And there was a silent spread that was going on. And they identified this too late, at the end of February, with the first death in France. It was in the north of Paris, in the region Hauts-de-France, in Creil. And then they realized that maybe it was too late. And then there was some kind of panic. And the second set of conditions, and then I will move the floor to Olivier, it's a cognitive kind to explain the lockdown. Because the Scientific Council who advised the president to lock down the country was really medically oriented. Two influential members of this council were doctors from one of the reference hospitals on the front line, which at the time of the decisions was overwhelmed with very, very serious cases, and they were frightened by the situation because the patients come to the hospitals in an awful situation. And it reinforced the dominant cognitive framework that conceive of the epidemic as a medical problem, where the sickest must first be cared for intensive care, maybe at the expense of other health situations, public health situations, and we'll come back later on it.
Olivier, did you want to add to that?
Yes,
chain of events?
Yeah, the lockdown is really, of course, is an intriguing decision because it wasn't planned for. I mean, it was none of the flu pandemic plan did not have that measure amongst the different solutions that to be applied in case of a pandemic. We in France we have a smallpox plan that was revised last year, which also does not plan for a lockdown. So this was a totally new solution, which it wasn't planned for, had never been tested. We had no knowledge about its effects, both its effectivity but also its side effects. So we really try to understand where this came from, and we still have to work on it. But the hypothesis is basic. I mean, it has to do with the fact that this. In the book, we use the notion of coined by Lee Clark and Sharon Chess of elite panic.
Yeah.
March 12, there is an elite panic. March 12, the authorities and the president and his government and the experts realized that the models they'd been working on, the models from Imperial College, but also the models from Institut Pasteur in France, with the different waves and which they hadn't given too much credit for up to then, were actually becoming real in the hospitals. In particular, the main Parisian hospitals, which were the top hospitals in this domain, were being overwhelmed. And then, so it became clear on March 12th that as Patrick said, there's no time anymore. We must do something immediately. Macron is supposed to have said that on March 12, if we don't do something very quickly, in a week, we're all gone. Meaning there'll be so many people dead that there will be a revolution or something equivalent. So there is this idea that they must act immediately. And as a president of the Scientific Council himself says, the lockdown was the only possible solution. And it had been, and so of course it had been undertaken in China, had been undertaken in Italy. So there were precedents. They had also, I mean, some of the members of the Scientific Council had worked in developing countries where this had been applied, so they had some knowledge about it. But still, I mean, it's in the end, it is people who participated in that meeting, particularly members from the government, were very reluctant to lock down because I mean, it's something that just was not at all familiar, and nobody knew what the consequences would be, and this is where what Patrick was saying before is really important. I mean, the fact that we didn't rely on the plans and on the agents, dedicated agencies, meant that we could invent a whole totally new solution without relying on existing options like quarantines or tracing or isolation or just closing schools. We could rely on something totally new, and this is what happened. And last point on this, I mean, Macron, when he decides to follow the Scientific Council's advice, is also in mind what is happening elsewhere in Europe.
Right. And
he has the feeling that he must do something. He must act very strongly if he wants to be able to show that France is taking this very seriously and wants to be seen as a strong government protecting its population. So there is an element also of mimetism or mimicry with this happening in Italy, also in Spain. And so he also has in mind the international reputation of France in this moment.
I want to remind folks that you're listening to COVID Calls. We're talking about the pandemic in France and the lockdown decision with Patrick Castel and Olivier Bourratz. And I want to follow up with that. I mean, thank you for that set of observations, because I think we have, even people like myself who's been following this closely, it's easy to lapse into a sort of an inevitability around the steps that must be taken in the pandemic, as if we know what those are. And I think you're slowing us down and talking about, first of all, the steps that were available to be taken and not, and then the rapid decision taken, if I'm understanding right, within 5 days to take very dramatic set of steps which had never been modeled. I want to follow up on just two parts of that. One first, are you saying then, and particularly, Patrick, you were pointing out the emphasis of the medical in the decision making, the overwhelming of the ICUs, which is, by the way, terrifying.
Yes.
And I think any elected official who sees what we were seeing in these hospitals around the world, I don't blame them for wanting to take action.
Yeah.
However, that leaves out discussions around impact on the economy, impact mental health. How we could talk the rest of this discussion about the many other kinds of impacts that flow from a lockdown, which then, as we learned in the United States, there's a sort of a political feedback mechanism that then sometimes, if you commit to the lockdown, it opens up a possibility for political counter reaction, which is hard in itself to manage. I know that hasn't been quite the case in France as it's been in the US, but it has been part of your discourse, I think. So let me ask you about that part first. In some of the existing plans, like your flu plan, were issues around the economy, schooling, elder care, those broader concerns, were those part of the discussion? In other words, they could have stuck to those plans and maybe had a way to control the pandemic without going to this new idea of the lockdown.
Well, when they could have, if they had activated the plan in January, which interviews in our ministries, people said, but they were really surprised. Many ministries were really surprised that we didn't activate, because activating the plan in January would have meant beginning to anticipate and work on different scenarios and maybe have a more staged approach to this. But by not activating the plan, and there are reasons behind this non-activation of the plan, I mean, that are also interesting, because they also relate to bureaucratic battles and tensions between the Ministry of Health and Civil Defense, for instance. And so behind this decision, I understood there are reasons, but this then means that when, as Patrick said, when on March 12th, they realized that the tsunami is there. There is no possibility for a staged approach. And at this moment, at this moment, they know that there will be consequences, but they don't know which consequences, because, as I said, we've never tested this before, and no one has, and there are no scientific publications on this, so we don't know. But they know that. Now, what is striking in the French case is that we didn't set up anything to try to monitor these consequences. We just sort of experienced them day by day, but there was no effort. And this is something which still puzzles us, is why no one tried to organize something to sort of monitor on a day-to-day basis the consequences on the economy, the social consequences, the health consequences, all that. So now we have some hindsight on this. We can understand better. But at the moment, there was clearly the idea that there would be consequences, but given the magnitude of the wave about to go over the French hospitals, if we don't do something now, immediately, we will lose the French hospitals and we will lose the whole healthcare system. So that's the way it was really framed. And an important part of this is the fact that members of the Scientific Council were precisely working in those Parisian hospitals that were the hardest hit.
Right.
So they were seeing the crisis immediately in front of them. And as you said, it was hard not to do something at that point. So the other consequences were irrelevant in the face of something which was about to overtake all the French hospitals. Now, if you had in that committee medical health professionals from the south of France, from Bordeaux, from Toulouse, from Marseille, maybe they wouldn't have had the same position, because their hospitals were not as hard hit as the Parisian hospital.
Let me follow up with the second part of that you were alluding to, and that has to do with sort of cross-border Let's frame it two ways: cross-border cooperation and cross-border rivalry. So what was the government learning, taking from what was happening in Italy, what was happening in Spain, what was happening in China? And I guess might be worth mentioning the EU, to the extent that the EU had some sort of capacity to facilitate sharing of information within different countries. How does the world outside of the French border begin to shape the French policy making apparatus in those days around the lockdown and just after?
We don't have a lot of information on that for the moment. I mean, there is one important point of information, is the fact that the health professionals, in particular the people in how do you say réanimateur?
Intensivists.
French intensivists were discussing with their Italian colleagues around the end of February, and their Italian colleagues were telling their French colleagues that the situation was really bad in Italy, and that they had a hard time understanding why France was not doing anything on this pandemic, while they were already facing very serious situations. And French intensivists and Italian intensivists are very close. They work very closely together. They admire each other very much. They consider themselves to be amongst the best in the world. So when the Italian intensivists were telling the French colleagues, this is really a bad situation, why aren't you doing anything? The French intensivists started saying, well, maybe we should be doing something about this. And this is when it started. They started mobilizing and preparing and thinking about something much bigger. Otherwise, there's not been a whole lot of cooperation, to our knowledge, across countries. I mean, and it's been mostly yes, border closures, competition to buy masks. There's been some cooperation to send patients to Germany from the eastern France, because one of the hardest regions in France hit in the beginning was the east of France, with the German border. So we did send some patients to Germany, but otherwise, for the moment, we haven't noticed anything particular in terms of coordination, cooperation, or even the EU. There's been a lot of mimicry, as you said, a lot of mimetism across borders. I mean, and it's been going on ever since. We now the recent measures in terms of curfews and then lockdowns were justified on the basis that everyone else was doing it, so let's do it also. So there is this type of adopting other countries' practices, but we haven't seen a lot of cooperation or coordination for the moment.
We may just add the Swedish model that act as a counter example. Right. The government and the experts say, look, the Swedish have not locked down, and they do it very badly in spring, during springtime, and it was like a rhetoric to confirm and to justify what they decided. And now, of course, the figures are a bit less good for France in comparison with Sweden. So we will see what. But it's interesting to see that they compare with Italy and Spain. Everybody has locked down, and they chose to show Sweden, to blame Sweden for not taking this kind of strategy.
Let's talk a little bit about maybe some of the more unexpected or positive things you might have observed organizationally. Cooperation where you might not have expected to find it, maybe in the healthcare sector, innovation, non-governmental organizations, even private organizations rising up, to supply personal protective equipment.
Yeah.
Tell us what you're observing in that regard.
The most striking thing we noticed in this case, of course, there have been some innovation, and we know that, for instance, for mass protection, there have been some cooperation between local firms and hospitals to provide them with mass protection and so on. So, or respirators, and so there have been some innovation. There have been also a creation of what they call the COVID center, which was in the primary care, an organization in cooperation between primary care physicians to organize the screening, but it was quite marginal because the main screening processes took place inside hospital. But the most striking thing is about the cooperation inside hospitals, because for those who know, as we have worked a lot on the work in the hospitals, and hospitals is a place of conflict, like most organizations, and there are many conflicts between specialties, there are many conflicts between physicians and management, there are hierarchical conflict, and so on. And the thing is that few weeks before the crisis, there was a major conflict inside hospitals between the management and physicians and nurses about the management of hospitals. And so the pandemic arrived at the very bad time for hospitals. They lack some protection masks, they lack some resources, and at the end, they manage the crisis and the number. And so how can we explain this conflict? In the media, and of course also the representatives of professionals explained that it was the ethics of health professionals, the will to save others, the altruistic commitment, and so on and so forth. Of course, this is important because it explains that they continue to work, but it doesn't explain the cooperation, because the ethics doesn't disappear in normal time, and in normal times there are some competition between the, and so we at the end we explain, we identify 4 conditions to explain this relative cooperation of care professionals within hospital. First, the doctors took the lead of the organization inside hospitals at the expense of the management. So the management say, okay, to reorganize hospitals in a crisis, you will do it. You will say what kind of beds have to be changed from normal care to intensive care. And so first condition, doctors were free to organize themselves. Secondly, there were no limits on the budgets. And Emmanuel Macron, during a discourse, said, quoi qu'il en coûte, whatever the price. And so everybody inside hospitals understood that there was no limited budget. Thirdly, they eliminate the non-urgent activities, as we mentioned before. So they stop what are the issues at the heart of conflicts in normal situations. So they have been put into brackets. Surgeons stop to practice surgeries. And finally, there was no longer any competition to capture a rare resource, the patients, because the patients were everywhere. So they didn't compete for access to patients. As we understood also, so we interview a lot of intensivists, and they say that finally COVID patients are, in a way, they look the same. They don't. There is no complex patients related to COVID in comparison with other health problems they have to take care of. Intensivists said COVID patients, it's not very difficult. Of course it's stressful. It's awful because there are many deaths, but it's not very technical. When you understood some basic things, then you can manage it. So there was not only competition to have what doctors say, what's the most interesting patients related to COVID. They look about the same. And so if these 4 conditions are met in any organizations, whatever its nature, there is good chance that the actors will cooperate. And the thing is that they cooperate on the care, but they compete fiercely on clinical research because there was a lack of resources. And at the end, they are quite disappointed as they collectively manage these crucial issues about clinical research because they competed with each other. So, but they are the same people who cooperate on an issue but compete on another.
I have to say, I'm very drawn to the way you frame this, which is that you start with the idea that these experts, even though they work in the same building, are going to compete and disagree with each other and be at each other's throats. So the challenge is to explain cooperation. And of course, we've people who, like yourselves, who studied disaster and sort of society and disaster, we make a lot of the pro-social response, and I wonder if that hasn't been a little bit too overdone. That we would expect that people will help each other in disaster. That's kind of treated like a
given,
a rule in disaster. But I think you're showing us how useful it is to problematize that from the get-go, and to really not just assume sort of basic things about human behavior in disaster and then be surprised when they don't work. I'm looking forward to reading more about that aspect of the work you're doing. Let's we're almost up on time, but I want to just follow up on one thing, or bring us up to date. So you're under lockdown now. So they do have a model now, in a sense. It's a recent one. So the model from March. Tell us about what was learned from lockdown number 1 that seems to be informing lockdown number 2.
Well, in terms of what we've learned, I think one of the main lessons is about the consequences of the lockdown. So we've learned that the consequences of the first lockdown were monumental, both economically, socially, and in terms of healthcare. So in French hospitals now, the second lockdown is very different from the first lockdown, because surgeons, but also all the other health professionals in hospitals, refuse to sacrifice other patients for COVID patients. There's been some deprogramming, but not as much as in the spring. And there's really been a resistance on the part of health professionals to continue treating other diseases, other health problems, because we already have figures on the consequences of the first lockdown on cancer treatments, on screening for cancer or for AIDS or other diseases. We also have data on psychological diseases. I mean, lots of public health issues, and it's very worrying for the next few years. So this is the first difference, is that hospitals are trying to continue their normal operations, and at the same time managing COVID patients. And this is creating tensions within the hospitals. So compared to the first lockdown, the second lockdown is much more stressful in the hospitals, because there are more tensions, because they don't want to. At the governmental level, we've seen the economic and social consequences, and so I think this explains why the government took so long in deciding as a second lockdown.
Right.
Waited very long, and then abruptly, once again, decided to lock down, because they had seen the economic consequences. And the fact that the schools remain open, for instance, is a very important difference, because we know that if you close down the schools, you're basically closing down the economy once again.
Right.
And they didn't want to do that. So even though some experts were calling for closing down schools again, the government decided not to do that, because they knew that it would have major impacts. Now, what hasn't changed is the fact that we still take decisions without any anticipation or preparation. So when Macron decides a curfew on October 17th, and then a lockdown on October 28th, this is a very abrupt decision. His services have not been preparing for this. They've not been working on this. So all the ministries have to immediately adapt themselves to this new decision, to which have not been prepared. So this lack of anticipation has not been changed. And the other difference is, as I said before, is that now decisions are really staged in this Council for Defense and Security, which has become a very central piece of the decision-making process, while the crisis management system is really, on the side and doesn't play a major role anymore. So the lessons, there's some lessons have been drawn, but the worrying part is that we have not learned in terms of how to anticipate and how to prepare for these decisions, and they're still taken very abruptly and very top down. There is still very little. Another similarity is the fact that we still do not take into account the implementation of these decisions. So there is still very little information from the services that will be in charge of implementing these decisions that they can inform the decision makers. And this creates also lots of problems. So one of the paradoxes we want to work on in our current research project is comparing these two lockdowns and these two waves, if you want to use that metaphor. And because in the first lockdown, surprisingly, organizations did not collapse. There was no organizational collapse. We didn't notice organizations being suddenly just simply overwhelmed, and they adapted. The state services, state bureaucracies actually were quite effective in adapting to this new situation and improvising. But this is very different to the second wave, where there's less capacity to improvise and adapt, because what Patrick was describing for the hospitals is true for many other state bureaucracies. I mean, there was a sort of lifting of normal constraints that allowed for more cooperation. These normal constraints have been brought back in. And so all these organizations now have to manage both their normal activities and the pandemic and its consequences. And this is creating tensions. And so there is a possibility of some organizations collapsing in the second wave, paradoxically, even though the second wave is less strong than the first wave. It's creating more tensions on organizations, paradoxically, because of this of this will to return to normal while still managing a crisis. Should we call it crisis? That's even another question.
Sure. Well, I mean, the model is one that everyone, I'm hoping, in different countries, and then doing comparables across countries is absolutely essential. And one of the things I'm hoping that we're going to learn a lot about in this time is fatigue, organizational fatigue, both, and we're thinking about metaphors here, the fatigue of the individual's body, but also the organizational body, and what that means in the United States. We've seen this in the midst of a transition of power, in which a sort of ordinary bureaucratic fatigue of 4 years means you do replace people, you do bring in fresh ideas, you do bring in people who've not been working 20 hours a day, 7 days a week. It matters. But I'm not sure we have good, you know more about this than I do. I'm not sure we have great theories about that. And I'm resistant to using the war metaphor for a pandemic, but I'm hard pressed to find other kinds of disasters where we do see this duration of time that allows us to understand organizational fatigue.
Yeah, absolutely. And I think this is one of the points. I mean, all the interviews we're conducting at the moment point to this problem of organizational fatigue and the fact that it's harder for them to improvise and to find solutions to the problems they face, and there is, I mean, the lack of perspective also doesn't make it easy. I mean, in the spring, in the first lockdown, we had a time frame which shifted a bit, but still we had a time frame. In the second wave, Macron gave us a few days ago a time frame, but it's not very clear when actually all this will end, and so this also creates a problem of anticipation for individuals and organizations, because they don't know how long this is going to last, and they also know that once this crisis is over, there is a social and economic crisis looming behind, which is going to be even bigger, and we can measure the consequences. And remember, in 17 months we have a presidential election, which also creates opportunities for conflicts. And on top of all this, we also have at the moment very important security issues in France, debates around immigration, migration. It's not this is a very and even though these are different topics, they are interrelated, and they tend to create a climate of this general distrust, which is not very helpful in getting out of this crisis and thinking about how we can rebuild our economy. So I think this also creates a lot of anxiety at an individual level and organizational level.
I've kept you up very late for this discussion, and I appreciate it. But I do. Maybe we can close with one sort of final little half a question, because I want to bring you back in a few months and we can talk about this more. Which is, you alluded earlier to the 2003 heat wave and the deaths there, and then and the SARS pandemic, which, like in many countries, you get a confluence. Maybe one disaster is not enough to force a reimagining of a disaster bureaucracy, but two in rapid succession often will do it. I think that's what you described in France. Do you think that you're on the verge of something like that now? And I think of this because you've described this scientific council, which now seems to become an improvised, semi-permanent body, which was created and now still continues to sideline the plan. So you've got sort of rival bureaucracies to a certain degree.
Yeah.
Is that an inflection point for France? Do you think that scientific council will emerge as a sort of standing feature after this? I'm asking you to speculate, which is always uncomfortable for social scientists and historians, but maybe.
Well, yeah, I mean, already, I mean, when Macron the other day talked about the vaccine program, he immediately said he was going to set up a new scientific council for the vaccination program.
Another one.
Yeah, and there is an existing council on vaccination, which could be, I mean, whose purpose is precisely to handle these situations, but still he's creating his own separate scientific council. So yes, this might be something, a recurrent practice. In the book, we do spend a lot of time at the end insisting on the fact that we don't know. I mean, and this is not just France, but we don't know how to draw lessons from crises. We don't know how to learn from these crises. I mean, this is not specific to France. I agree, but in the French case, there really we argue for a revolution in the way that we try to learn from these crises and try to build more cumulative knowledge on these crises, both their origins and also the way they play out. And this is, and hopefully we can expect some form of lessons to be drawn, but more importantly, the idea that we can learn from these crises, and then they're not just singular events happening here and there out of the blue, and then just we can come back to our normal way of working. We really hope, but this is really hope, wishful thinking maybe, that this crisis will be the opportunity to sort of, yes, decide that we need to draw lessons from these situations, because they are going to be more and more repetitive, because we do see the recurrences with past crises, and that we cannot just come back to the normal way things work and just hope that the next crisis will be easier to handle. But this requires a pretty big revolution. So it's hard to say.
And maybe just add a quick point. So we are also concerned that the current crisis, since it has been framed as a medical problem of hospital capacity, of intensive care, will not bring about lasting change in the area of public health, because this would be another disaster, because the public health is very weak in France, and if the only thing we learn is that hospitals need more money, which is probably true, but if it's the only lesson, then we will through a very an elephant in the room. An elephant in the room is the weakness of the public health.
This is the dialogue in the United States around the vaccine, that somehow you reach the techno fix of the vaccine and the pandemic is over, and yet we don't have the medical facilities up to date to roll out a vaccine. You literally don't have the place to do the vaccine. It's somehow, by isolating the problem in this highly technical way, and this is where we started our discussion, you miss the much broader field of what a disaster actually means in a society at this scale. I want to thank my guests, Olivier Bourras and Patrick Castel. I learned a lot in this hour, and I do hope we can get you back to talk more about it as we go into the new year. And I want to remind everybody, you're listening to COVID Calls, and you can catch COVID Calls every weekday at 5 p.m. Eastern Time. Tomorrow we'll be talking about COVID-19 in the American Midwest with Keith Mueller from the University of Iowa. So please do join me for that. And Patrick and Olivier, thank you so much for your time tonight.
Thank you.
Stay healthy, everyone. We'll see you tomorrow, 5 o'clock.